The most common sheep diseases. If a sheep is sick, then you may need to separate her from the flock. In traditional sheep sheds, there are usually several boxes. Keep ready fences that you can use to build a separation box when needed. If you permanently want to keep an animal separated, then do not separate one animal alone. It is always better to keep at least two in the same box. All sheep must be able to have at least eye contact with others. Never put a sheep alone in a separate building. Do not tie a sheep up for more time than needed for treatment. If the sheep has a disease that it can pass on to others, you should always put in a separate box according to guidelines of your veterinarian. Usually you find the quickest help in your own sheep network when you need advice concerning a sick animal. Especially in the beginning, you will need more support when you first learn to judge and act in different situations. If a sheep lies down and does not stand up, then it's a good idea to call the veterinarian. However, there is much that you can do yourself in order to prevent illness. By keeping an eye on your sheep more than one time per day, you will quickly see if there is something wrong with your sheep. Some diseases develop very quickly, and you will have little time to act. The larger the flock is, the larger is also the possibility not to notice in time that somebody is sick or missing. In small traditional sheep flocks, it is much easier to care for your animals. A sick individual often walks outside the main flock on the pasture. In some countries, there has been an old habit to tie up the leader ewe on the pasture and letting the rest of the sheep range free. The flock won't leave the leader ewe under such circumstances. This is not a good thing to do, as the leader ewe cannot show the flock where to graze, nor can she give a clear signal for the rest. If she is attacked by a dog or by insects, she cannot run away from them. You should keep some basic things at home, like a fever thermometer, disinfection medicine, selenium, germicide salve, worm medicine, and sirens. When you call the veterinarian, you should make sure that the sick animal is either separated or that you can catch it easily. The veterinarian needs to know the sheep weight in order to prescribe medicine. Sometimes more than one person is needed to assist him. Sheep may spit out pills. Pills are easiest given if you crush them and place them in powder form between two bread slices. Medicine in fluid form to be swallowed is best given by using a siren with no needle. Sick sheep do not often open their mouth but press their teeth hard together. Bring in the siren between the teeth and cheek. Press it as far in as possible and empty the siren of the medicine while you keep her head slightly up. In the following, some common illnesses are described according to their main symptoms. Coughing, weaknesses. All sheep normally have parasites, but they should not get too many of them. There are many different kinds of parasites. General symptoms of too many worms may be coughing, loss of weight, diarrhea, or general weakness. It is recommended to treat sheep for worms automatically twice a year. Chemical worm medicine has a negative effect on many insects in your meadow, and that is why it should be given at least 1 week before you let them out on the pasture. Part of the chemicals will come out with their droppings. The second time to give warm medicines is best in autumn when you have taken your sheep inside for winter. It is good to use different types of warm medicines, but this is not always possible in practice. Avoid keeping sheep on low-lying pastures where they may get common liver fluke, Fasciola hepatica. By keeping sheep on a large enough pasture or using co-pasturing, you may have to give less medicine to them. There are many traditional methods in preventing worms to grow too much. Aspen or alder leaves, bark of pine, or spruce needles may keep the level of worms down. Sheep may eat slightly poisonous plants, like lily of the valley, Convallaria maialis, plants with clear medicine effects like salix bark, herb Paris, Paris quadrifolia, alder buckthorn, Frangula alnus, and oak acorns. These plants may keep the amount of worms down naturally. Natural plants are good to use in preventing the number of worms to grow, but if a sheep is already sick, then give it chemical worm medicine, as it will quickly reduce the amount of worms. There is no need to treat the whole flock with worm medicine on a regular basis. If you have a small traditional sheep flock on large semi-natural areas, then it is enough to treat animals that have some symptoms. In general, you should avoid moist pastures where there is a larger risk for different types of parasites. Sheep can have sheep liver fluke, Fasciola hepatica, that needs a small snail in its life cycle. There may also be lancet liver fluke in the liver. It needs both snails and ants in order to propagate. In the intestines, there are coccidiosis and cardia duodenalis. Coccidiosis for lambs starts with bad-smelling diarrhea that later will be mixed with blood. Roundworms and tapeworms are also in the intestines. Tapeworms can be seen as small white parts in the manure. A beetle carries on the tapeworm's life cycle. In the lungs there may be lungworms that also use snails to carry on their life cycle. Diarrhea. Diarrhea is often related to digestion problems. Sheep also get diarrhea because of too many parasites or bad drinking water. Some sheep have a more sensitive stomach than others, and they may easily get ill if it is a rainy summer. If the sheep feels normal but has diarrhea, you can try to give it baking yeast. Start with 10 gram for a sheep about 30 kilos weight. Put on a bread and give it twice a day and later slightly more. You can do this for 1 week. Sheep can also get diarrhea if they have eaten poisoned plants or if they have been eating mold in the hay. You can try to give them medical coal, the same that you give to humans but in a larger dose, or oak bark tea or pills. Always call a veterinarian if the sheep develops a fever or it is too weak to stand up. Water is easily given to sheep by using a PET bottle. Make a hole in the bottle cap with a nail. Press the bottle between the teeth and cheek. Press the water towards the cheek, but take care not to press it directly into the throat. Weak lambs. It is very important that newborn lambs get colostrum within 2 to 4 hours. A lamb needs 0.5 to 1 liter colostrum during the first day and night, at an interval of 2 to 4 hours. Lambs get chilled very fast and lose energy. In an emergency situation, you can wrap the animal in a blanket or take it indoors for some time to warm it up. A lamb should not stay too long without its mother. You can make an energy drink for weak lambs of 1 egg yolk mixed with a similar amount of cream. It is also good to give vitamin and selenium to a weak lamb as an injection. You can milk colostrum from the ewe that lost her lamb and put it in the freezer to use later when needed. For long-time storage in deep freezer. You may not warm colostrum in a microwave oven. 1 deciliter is enough for 1 portion. Abscesses. Sheep often get abscesses. Normally they heal by themselves. Do not start to remove them, as they will most likely get infected. An infected abscess should be treated with antibiotics. A small skin wound. Insect protection. If your sheep get a small skin wound in summer, insects may start to suck blood from the wound. Tar is an effective help. Tar has an effect of about 1 to 1.5 weeks. After this, you may have to put new tar on. Do not put tar on large wounds. Use tar that has as little chemical additives as possible. A sick animal can be covered with broadleaf branches on a hot summer day in order to prevent insects from attacking it. Elos. It may happen that animals eat too much clover, apples or flour and get too much air in the stomach, resulting in elos. It is important to start to treat the animal immediately. You can give it ordinary kitchen oil, 1 tablespoon for adults, 1 teaspoon for lambs. And then start to massage in order to get the gases out. The sheep should start to burp and fart if it works. Stand behind an adult sheep with your face in the same direction as the sheep's face. Move your hands on both sides of the sheep clockwise. You can take a small lamb on your lap and place it with its back towards your stomach, and then giving the massage. Do not press too hard, and do not massage for too long at a time for a small lamb. You can give vodka mixed with water, half glass vodka and half glass water, to an adult sheep. This makes the sheep relax quickly and helps on possible ills. Halting. A halting sheep should immediately be caught and checked. Most likely it has a small stone or piece of wood between the hoof. A sheep can also halt if you have not cut the hooves regularly. A too long hoof bends under the foot and results in halting. If the hoof is damaged, you should judge if you can cure it yourself or call a veterinarian. If there is a white mold or bloody wound between the hooves, then call the veterinarian, as it may be infective hoof root that can be carried on to other sheep. In this case, the whole flock will be treated for hoof root. Sheep itching itself. Insects. Sheep can itch themselves when they have needle from the forest in the wool or when hair itches the skin. If there is a lot of mosquitoes, then sheep starts to stamp and itch their legs. They may start running in order to get away from them. Tar odor may keep insects away. Sheep, especially fine wool sheep, can also get wool parasites which make them itch themselves. You prevent wool parasites by shearing the sheep at least twice a year. There are several chemicals that can be used in the treatment for wool parasites and for keeping insects away, all with different active ingredients. For example, deltametrine, Flytix, Cupersect, and cypermethrin, Ecofleece. Some are in oil form to be spread on the back of the animal, others are injected and spread with the blood. Some outer parasites suck blood, for example the sheepkid, Melophagus ovinus, whereas others only eat dead skin and wool. Call your veterinarian for advice if you have blood-sucking parasites. Blowflies can attack sheep on warm and humid summers, especially if they have not been sheared regularly, are dirty, or have a wound. Blowflies larvae eat a hole into the skin and start to eat meat on living sheep. Blowflies develop very quickly. Call a veterinarian if you notice blowflies larvae on your sheep. Start picking away the larvae as you wait for the veterinarian. The wound should be cleaned and larger wounds treated with antibiotics. The following outer parasites may make sheep itch themselves and need treatment. Ticks, Ixidioide, sheep biting louse, Tamalinia ovis, sheep kid, Melophagus ovinus, sheep bot fly, Oestrus ovis, leg mange, Coreoptes bovis, sheep scab, Soroptes ovis, itch mite, Sarcoptes scabiei variation ovis, sheep face louse, Ligognatus ovillus, and blow flies, Califioridae. Wool falling off. The wool may fall off sheep on areas as large as a hand. If the wool peels off from the neck, it may be a result from the fodder in winter when they are indoors. Sometimes wool just drops off on the back of the sheep or at some other part of its body. There may be several reasons. There can be parasites in the wool. Perhaps the stable has too high humidity and it's too warm. Check the ventilation. Sheep may become allergic to ammonia. Keep their laying place dry and clean. There may be lack of some mineral. Give them a mineral barrel so that they can lick what they need. There may also be something wrong with the metabolism. Using the wool starts to grow out again in spring. Some native sheep normally change wool, but never so that the skin is bare in between. Eye or ear infection. Some may get sheep eye or ear infections. Call your veterinarian to get help. Hair falling off the face and ears. Cracks. Photosensitivity. If your sheep lose hair on the ears and the face and there comes cracks in the skin, then it has most likely eaten some poisoned plants on the pasture. Take it inside and keep it in a dark place until the wounds are healed. Give it only dry hay to eat. Do not give any green-colored fodder at all. Scab may also have same symptom. Contact your veterinarian if you suspect scab. Lying down with spasms. If the sheep has fever, then it may be some soil bacteria that has resulted in an infection. If the sheep has no fever but spasms, it can be CCN, cerebrocortical necrosis, which is treated with a large dose of B vitamin. In all cases of spasm, you should call your veterinarian for help. Sore mouth infection, ORF, contagious pustular dermatitis, contagious ecthyma. Separate the sheep from the rest of the flock so that they cannot be in contact with each other if your sheep get blisters around the mouth and nose. Especially lambs may get this, but also adults. It is very infectious. Sheep may have such a pain in their mouths that they have difficulties in eating. The lambs can also carry on the virus to the udder. Orf virus is a zoonosis that can carry over to humans. You can put on some disinfective salve and some oil to make the skin soft, for example, calendula. Use gloves to protect yourself. You need antibiotics if there is an infection.